Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Welcome to rePROs Fight Back. I'm really looking forward to today's conversation, mostly because we have a wonderful advocate from Uganda here with us today, and partly because we're talking about the importance of young people having access to comprehensive sex education and sexual and reproductive health services. So, without further ado, joining me today, we have Maureen Andinda from Hand Uganda with us today. Maureen, thank you for joining us.
Thank you for having me, Jenny.
So, what brings you to Washington, D.C.?
So I'm part of a Global Youth Ambassador Fellowship with Planned Parenthood Global, who are partners back in Uganda. And I'm here to share what it is that we're doing as Reach a Hand back in Uganda in line with sexual reproductive health and rights for young people, but also to learn from local affiliates what it is that they're doing here, how they're advocating, and just see the great work that everybody's doing for young people.
Oh, that's great. Yeah. So do you want to tell me a little bit about Reach a Hand Uganda and the work you guys do?
Sure. So Reach a Hand Uganda is a youth-led and youth-serving organization that is premised on youth empowerment programs for young people with special focus on sexual reproductive health and rights and livelihoods. We carry out interventions in over 33 districts in Uganda, and we use different intervention methods that target different stakeholders. So we do community outreach, we do dialogue, we do advocacy with national stakeholders, we do communication and online campaigning just to get the message out for the betterment of our target audience, which is the young person.
Oh, that's great.
Yeah.
So how did Reach a Hand Uganda get started?
Our founder, Humphrey, at the time was raised by HIV-positive guardians, and his experience was that of stigma, because people thought that he had HIV, and the way that they treated him was not okay. So he thought that it was his responsibility to educate people about HIV at the time, and also help young people around him to understand that HIV is not a death sentence, that you can live positively, how you can prevent stigma, how you can help other people to deal with stigma and that sort of thing. So together with a bunch of friends, I started doing outreach programs in schools to just really share information. And from that, the realization came that there was a need to equip these peers who are sharing information such that they had the correct and accurate information. So they started doing trainings, and that is how Reach a Hand started. So our motto is we identify young people, train them on SRHR information, and then they go out into communities and schools and talk to young people. So whereas it started with HIV, it has really morphed into so many more themes on sexual reproductive health and rights.
That's so important, and so great to be reaching out to the young people to make sure that they're engaged and informed. Mm-hmm. How did you get involved?
I was in the nonprofit world before, but I was working on leadership and governance at the time when I met Humphrey, and there was an opportunity to apply for work at Reach a Hand, and I thought that I could take that experience that I had from my work as a program coordinator doing leadership and governance and sort of like bring that to Reach a Hand. At the time was such a small team. We were learning as we went along. So that is really how I joined. And from that time, I've learned so much in terms of what it means for young people's rights, what it means for young people to have access to information, and really the challenges that they go through every day, and how we continue to navigate around those challenges.
That's how you got started. So what do you do now with Reach a Hand?
Okay, so my title at Reach a Hand is Monitoring, Evaluation and Learning Manager, but We are fairly a small team, so you find that oftentimes I double dip.
I can relate. Our office is 4, so I feel you.
Yeah. I make sure that the targets for the organization are in line with what our strategic goal is, and that we're on track, and that we are actually picking lessons from our implementation and improving on our programming. I also lead on a couple of advocacy projects for the organization to really ensure that young people have a conducive environment within which they can access information and services on reproductive health.
That leads right into, why is working on sexual and reproductive health and rights and comprehensive sex education so important to young people in Uganda?
It's important to provide context around Uganda, and one of the things that is important to note is that Uganda has one of the youngest populations in the world. We have over 75% of the population being young people under the age of 35.
Wow.
And with that, we see so many challenges that the young person faces. And whereas on face value, they look like economic challenges, they look like social cultural challenges, they look like political challenges. A lot of the times, these issues are deeply rooted within sexual reproductive health and rights, in as much as many people don't know that. So for us, it is important to equip this big chunk of the population with information and knowledge that will enable them make informed choices. And that way, when they have their sexual reproductive health well taken care of, then they're able to get decent employment. They're able to decide if they want to have children or not. They're able to just really have a decent life as human beings.
So what really struck me in that is that 75% of the population is 35 or younger. Why is the population of Uganda so young?
Okay, so I think one of the reasons why we have such a youthful population is, first of all, the fertility rate is really high in Uganda. I think it dropped down to maybe 6.75. It used to be 7.5.
Okay.
So that means like approximately 7.5 children per woman. So that's one. But also, between the 80s and the 90s, there was the huge HIV scourge in Uganda, and a lot of the older population lost their lives to HIV at that point. So you have a lot of the population being young people, but also being maybe orphans of people who passed away because of HIV.
So some of our listeners may know, but a lot of them may not. But Uganda recently received a lot of media attention for banning sex education. But some people may not know that fairly recently there was an exciting update on the progress to advance sex education in Uganda. Do we maybe want to take a step back and talk, before we talk about the good news, talk about how the ban came to happen?
Prior to the ban being affected by the Ministry of Gender, Labour and Social Development, which is the ministry within which the youth docket falls in our country, there was media outrage, social media outrage over explicit content that was found in one of the schools, and parents were not happy about it. So people went online and there was an uproar, and there was so much call for accountability for the government. And because of this pressure that came in from the public, the parliament was tasked to ask the minister to sort of provide accountability in terms of how did this come about, who is monitoring, who is looking out for the young people, how do we not know about it? So in an effort to sort of like put things in order, the minister at the time issued a ban to sort of give the ministry time to go back and restructure and organize the way in which sexuality education would be taught in Uganda. This was, I think, in October 2016. And since then, developments that came up, there was so much frustration from civil society organizations, because if you put a ban on sexuality education, then how are young people going to access information? Yeah. How does, first of all, parents are not talking to their young people. Teachers are not teaching the kids in school. So if you put a ban on it, then already the limited ways within which young people can access information is taken away. So we had some members of civil society sue the government because they felt that the right of the young person to access information was being infringed on. And so like all of this pressure from Parliament, from civil society, from the general public, pushed at the time the Ministry of Education and Sports to sit down and develop a framework. So in May this year, the National Framework on Sexuality Education was launched to provide guidelines for how sexuality education would be taught. And from that document, then the National Curriculum Development Center could go on to develop a curriculum within which schools can use to pick up on, and the environment within which civil society can operate and do its work. Since then, the framework was launched. There was a bit of backlash from some stakeholders, primarily religious stakeholders, who felt like a lot of the consultations were not really consulted as much as they ought to have been. And also they had quite a number of issues with the content of the framework. So, for example, why is there content on sexuality education for 3-year-olds and 5-year-olds? So that kind of created like a stumbling block in the rollout of the framework. But that is something that is now being worked upon. They've brought the stakeholders back to a round table and discussed with them and sort of like given them an understanding of why it is important to have young people discuss, even 3-year-olds, to understand certain aspects around sexuality education. So that is a short summary.
It sounds very familiar. I mean, we definitely go through the same things here. It's funny, I was just reading an article yesterday in a conservative publication attacking some sex education that actually Planned Parenthood was doing. Surprise, surprise, they're going after Planned Parenthood. But they were going after a video they had put together around teaching consent, which seems super important in this day and age. Yeah. And they were really unhappy because it, showed somebody getting her boobs touched or something, and they were like all in an uproar. And I'm like, yes, showing bad touch to older students is kind of important to learn what is right and what is wrong. Yes. So it all sounds very familiar to things that we have here in the U.S. as well, unfortunately. So how did the ban impact Reaching Hand Uganda and the work you guys were doing?
So for us, the most immediate impact was that a big chunk of our target audience, which is young people in school, was cut off because we were not able to access schools to be able to carry out our programs. Our interventions are such that we do peer learning sessions, but at that point, everything had to stop. And like I told you, I hope I mentioned it before, like our target audience is young people the ages between 12 to 24, and a big chunk of that is still in school.
Right.
So by putting a ban on sexuality education, it means that we're not able to access the young people where they are. So that was the first major effect on our work. The other thing was that we got feedback from some of our audiences in terms of, but now if you stop, who is going to support us with this information, who's going to support young people to know where they can actually get services, where they can go to a health worker and speak to them. Really, that time between when the ban was implemented, there was really a gap in terms of information dissemination. And of course, information dissemination translates into access or not of services. So that was a big thing for us.
Yeah, I mean, if they're not learning about what they need or where they can access services, they're not going to be able to act on it and find the services they need or find the information they need, which is even more important. They might, turn to untrustworthy sources and perpetuate some myths that are going around.
Yes.
The current status, what's the current status?
Okay, so like I mentioned previously, in May, the Sexuality Education Framework was launched by the Ministry of Education and Sports, and we saw that as such a huge milestone in terms of creating a space to engage with our audience. And although we acknowledge that there is a lot that still needs to be done, it was a start. And we're optimistic because the ministry is very open to working with different partners, with different development partners, with different civil society partners to ensure that we can actually implement the guidelines and the sexuality education framework. So right now what is happening is it's being rolled out to different stakeholders, helping schools to understand what is entailed in the framework, what are the topics that you can speak about, how do you disseminate this information to young learners and the like. So that is what is happening currently.
Good. So that means you guys are back in schools?
Not exactly, but what it means is that now there is a structure within which, so now you can get approval from the ministry to actually go and conduct activities that have been approved, that have been signed off by the ministry.
So one of the things we like to talk about on this podcast is U.S. policy and how it's affecting things. Can you talk a little bit about how U.S. policy and politics are impacting your work?
I think the most relevant policy for us has been the Global Gag Rule. And although primarily it was around cutting funding for organizations that providing abortion services. Most recently, it extended, as I'm sure you know, to family planning and different other components of SRHR. And the impact that we've seen with that is that a lot of healthcare providers, partner healthcare providers, have had to close their doors, which then means that our young people are not able to access the services that they require and that they need. The other impact that we saw is an abrupt stop to some of the projects that we had because some of our funders were telling us that, this is actually happening. We have no money, so this has to stop. And it was quite heartbreaking to get feedback from our beneficiaries, feedback from our young people that we work with, asking questions like, okay, so what is happening next? Because we've trained youth advocates and we've trained peer educators in their communities. They want to engage with districts, but they're not able to afford transportation to go to these district meetings. Right. They're not able to check in with the health centers to see how many young people are accessing services. We used to have a project that was championed by youth advocates who would monitor the district's quality of service delivery and the input by different stakeholders. So, for example, what is the police doing about gender-based violence cases? How many young people have access to health services in a month? And all of that came to an abrupt halt as a result of the gag rule. So for us, we really felt it directly in terms of the projects that we were carrying out.
So another area that has been affected by U.S. policy is UNFPA. Does Reach Hand Uganda work with UNFPA on projects? And if so, how has that work been impacted by getting their U.S. funding cut off?
Yes, we do work with UNFPA. They're a funding partner. And the project that I am speaking about was one of those.
Oh, okay.
Yes, that had been funded by UNFPA. So it was such a blow to us because we had to put it on hold for quite a long time. And in order to do the groundwork to actually get it back on its feet was extremely difficult. So for sure, we felt the pinch, and I'm sure UNFPA felt the pinch as well, especially locally.
Yeah, what always strikes me with, the argument in the U.S. is that it's before abortion, they're cutting off funds to prevent abortions. And to me, when I'm hearing about what you're talking about, I'm just thinking about all of these young people who are losing access to comprehensive services that have nothing to do with abortion.
Yes. Or
losing access to birth control, which would prevent abortion.
Yeah. Yeah. So exactly, like it's such a paradox. Yeah. Because cutting off other services, for even health facilities or health service providing partners who don't necessarily carry out abortion work but do family planning, contraceptive services. It was such a huge blow because a lot of the healthcare providers in Uganda do not necessarily do one thing.
Mm-hmm.
Yeah. So a facility does contraception, a facility does HIV testing and services, it does STI screening, it does counseling. And by you cutting off funding for this one aspect of the health facility, it means you're closing doors to so many other health needs that people have.
Right.
So yeah, it was very unfortunate.
And it just makes sense, right, that facilities would cover all of these things because you don't want to have to go here to get this.
And then go there.
Right.
Yes, it has to be integrated.
Exactly.
Yeah.
So as we are wrapping up, do you have any final thoughts or any message you want to share with our audience?
Sure. The message that I would have is, I think the onus is on each one of us. Yeah. If you think that you deserve quality healthcare and that you deserve quality services, then you should want the same for somebody else. And within your capacity, whatever that capacity may be, we should try to do something to make sure that young people, or even just people generally, have access to the same things that we want to have access to, because then everybody has an opportunity, has a chance to have a decent life.
Okay, so in your wrap-up, you just mentioned the importance of making sure that everybody has access to services. And I think one thing that would be great for us to dig in a little bit, because it is so important, is the value of making sure that youth have access to youth-friendly services.
Yes, that is an extremely important aspect of health service delivery, because when you interact with young people, the things that hinder them or that stop them from actually going to health facilities to access services are things like lack of confidentiality. There is already stigma around being a young person. There isn't trust. There isn't respect. There isn't time accorded to young people. All of those aspects, in one way or another, could hinder young people from getting services. I will give you an example to sort of put the conversation into context. In some of the rural areas in Uganda, people walk kilometers or miles, to just access services. And young people will go out of their way to get the little that they have to be able to transport themselves to these faraway health facilities. And for them to get there and they're being judged and they're not being listened to, attention to their issues is not being given priority. So you'll find that a lot of the times they're like, I have to spend this little money that I have to go there and potentially not even get the service that I require. I might as well just figure it out or just let it be. So the aspect of youth friendliness is extremely important, because it would create that conducive environment within which young people are encouraged to actually share what their issues are.
Absolutely. I mean, if they aren't given a respectful welcome and felt like they've been heard, why would they go back? And they would probably also tell their friends that they had a bad experience and not encourage them to seek help either.
Yes, and there has been a debate around whether we should focus on youth-friendly health services or try to make facilities in general, to be accommodative of everybody and to give priority to everyone. But initially, that is what it's supposed to be.
Right.
But you will find that because of so many issues, like it could be social culture issues. In Uganda, I know that young people are only seen and not heard, So, for example, if you're in a line with somebody much older than you, the expectation is going to be that priority is given to this older person who probably may have a headache or may have, for whatever reason, priority will be given to somebody else, and because the numbers are so many, you'll find that day 1 you're there, day 2 you're there, day 3 you're there, and still the priority is being given to other people.
Gotcha.
So whereas that would be the ideal situation to ensure that all health facilities are friendly in general for everybody, you find that young people are not being included. So that is why we really, really push for youth-friendly health services.
Well, Maureen, thank you so much for being here and doing this. I had a lot of fun talking to you.
Thank you for having me, Jenny. This was fantastic.
For more information, including show notes from this episode and previous episodes, please visit our website at reprosfightback.com. You can also find us on Facebook and Twitter at reprosfightback. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.